Hello, everyone. My name is Frederick Bolonko, and this is my presentation for the Population Level Health Education Intervention Project. To introduce the community here, I focus on South El Monte at the zip code of 91731, where the health problems included diabetes, obesity, lack of access to healthcare services, and tobacco use, excuse me. We find that in this area, diabetes and obesity are the main health problems that are related to poor lifestyle choices, physical inactivity, and lack of education. Uh, Also, poor to access to healthy food choices. Looking at the background here, in this area of South El Monte, was the population was mainly Hispanic or of Latino heritage, with about 84.9% of the total population. There were also some whites and Asians, also blacks in the areas, but they consisted of a smaller population margin. According to the 2010 U.S. Census, this area in South El Monte had the median household income of 44,104, and also 19.4% of the people living in the area were below poverty level. Uh, Diabetes, we know that affects 1.5 to 2 times Hispanics compared to the counterpart whites. Looking at the health objectives of from the Healthy People 2020, I concentrated on diabetes, where the goal is to reduce the disease burden of diabetes mellitus and improve the quality of life for all persons who have or are at least at risk of diabetes. Also, I concentrated on access to health services objective, where the goal is to improve access to comprehensive quality healthcare services according to the website Healthy People 2020. There's also this nutrition and weight status is related to obesity, where the goal is to promote health and reduce chronic disease risk through the consumption of healthful diets and achievement and maintenance of healthy body weights. The last objective here is that tobacco use, where the goal is to reduce illness, disability, and death related to tobacco use and secondhand smoke exposure. Well, needs assessment of this area from interviewing key stakeholders in the area and conducting in-person interviews. I was able to make a needs assessment of this area, and after speaking to them, I found out that most of the Hispanics in the area do struggle with the chronic disease of diabetes. But I was also, from the survey that I conducted in the area, I found that there were no healthy food choices there, no fresh produce markets. People were not active. There was pollution, and also a lot of cigarette smoking. In my survey, I was able to deduce that also there's lack of knowledge about healthy habits or diabetes as a chronic disease, as well as uh, lack of uh, knowledge about healthy food. Well, using the proceed model here, see that this first part guided me to make a focused needs assessment of this community by looking at the epidemiological, behavioral, and environmental factors that affect the occupants of this area. And then also after assessing the needs, I was able to identify the policies, resources, and circumstances within the community that may facilitate or hinder the implementation of my interventions before I set out to uh, design outcomes and goals. The second part here enabled me to design the educational plan that addresses the community needs or identifies the initial phases. Also, after implementing the interventions or classes here, I was able to evaluate whether the interventions that were carried out as planned, or whether the interventions were carried out as planned, and also look at the initial success of the interventions and whether they are working to produce the desired outcomes. Looking at some issues the community, the people of this area face. Mainly the barriers here, you can see that there are knowledge deficits about the issues that they're facing. Also that there's a lack of knowledge about the resources that are available to them. Also, a lot of the people there were of low socioeconomic status. Also, mainly the problems there, like diabetes, were an inherited health problem, lack of access to healthcare services, lack of fresh produce markets, poor lifestyle choices like tobacco use, and lack of physical activities. And also, there was too many fast food choices and processed foods in the markets. But the access in this community, we found that they had a public health department here. Also, some community clinic or health centers. There were free and income-based clinics as well. There were public schools, churches, recreational parks, police station, and also a fire department. Well, upon interviewing these people in this community, it was apparent that of a lack of access to healthcare services, lack of knowledge about their healthcare issues, poor dietary habits, few healthy food choices, smoking and physical inactivities were contributing to their epidemic of diabetes and also chronic issues like smoking and obesity. When I carried my interventions here, I had the Healthy People 2020 objective in mind. Touching on diabetes here, to achieve the objective here, I had to in my classes, I had to provide information on the health risks associated with diabetes, as well as provide dietary and lifestyle modification education, and also exercise during these clinic classes. For access of healthcare services here, I was able to hand out in these classes, I was able to hand out a list of free and low-cost community resources that are available to the residents. I found out that most of these people didn't know that the resources were available to them. So making a list of the resources and providing the addresses was helpful to them. Regarding obesity, weight status here, I was able to teach them using individualized education plans while handing out information through pamphlets, targeting women and children especially in these clinics. And I touched on balanced diets, high protein foods, fruits, and vegetables. To reduce tobacco use here, this class I carried out at a food program location where I was able to speak to mainly young to middle-aged men about the dangers of smoking, and I was also able to hand out some smoking cessation pamphlets. For this education project, I taught mostly Hispanic residents in this area. I was able to acquire some materials from work with permission, which were both in English and Spanish. And these were, for example, touching on diabetes, diabetes care, and also smoking cessation. I found that the CDC website has a lot of resources, which include brochures and pamphlets, which anybody can print for free. And I was able to do that, and I made copies so that I could hand them out. For this project, it wasn't really, it wasn't too costly for each class. Most of the cost went to the teaching materials, which had to be copied. Some of them had to be color copied because you want them to appeal to the parents or the children, especially when we're talking about obesity and weight loss and dietary choices or lifestyle modifications. So that took a little bit of money, but thankfully I had some resources from work, like I said. I just had to make copies of those. Those are in black and white, so they wasn't too costly. And then I made copies from the CDC website, which was very helpful. The location, the community health center had a few health clinics that I was able to make arrangements, so they were able to avail the location. And one of the food programs was very accommodative, and they were able to let me help them while I was able to teach some of these people that show up to the food program about diabetes and smoking cessation. Organizational training is necessary, especially to be able to carry out 4 classes in limited time. Logistics, I was just able to, speak to my clinical facilitator, Anne, excuse me, who has done this before, and she was able to guide me. But Diane was able to make arrangements for me to be able to join in one of the health clinics that was had already been scheduled by the Central City Community Health Center. Evaluating this project, I thought that I was able to meet what I set out to do. My initial goals were just to increase the awareness of diabetes and access to health services, as well as help foster healthy lifestyle modifications and discourage tobacco use. I think I was able to accomplish this because I was able to carry out the interventions, and also from asking questions, you find that the people are able to restate it's like return teach back the instructions that I had given to them in their own words. So to evaluate, first of all, an impact evaluation is useful in measuring the short-term goals, and it determines the initial success of the interventions. While an outcome evaluation will be useful in measuring long-term goals to determine whether interventions carried out are working to produce the desired outcome. So in conclusion here, I was able to carry out my interventions without much of a problem. And fortunately, I had some resources with me, and I didn't have to go far to find resources to carry out the teaching. For example, teaching on diabetes and smoking cessation, I was able to get that from work in both English and Spanish. And also the CDC website was very resourceful with pamphlets and brochures for these different topics. It was just difficult to get time slots for the classes, honestly. But people are they tried, but they understand we have it's part of what we have to do in order to become public health nurses, and they were very willing to help. But it was a little bit rigid because some of the calendars were already designed 3 months in advance. And this an issue here was just the background checks, which tend to take time. And in the future, I would anticipate to maybe prepare for this adequately. Thank you so much for listening. These are my references. I appreciate your time.